My name is Dr. T, and I will be performing the Tingle immunity removal surgery on you today, okay? Okay, are you comfortable? Yes, have your meds worked yet? Okay, or are you feeling relaxed? We gave you some medication because anesthesia is not necessary for this procedure because it is completely painless, okay? Tingle immunity removal is completely painless. Okay, now I'm going to go through the procedure with you briefly. I'm sure that my colleagues have already gave you all the info that you need to know. However, because I will be the main doctor in the operating room today, I will be just briefly going over what I will be doing. Okay, so first off we're going to make a very small little incision on the back of your neck in the tingle center. Okay, and then we are going to examine it firstly, and then we will be solving the problem of your tingle immunity. Okay, there could be a lot of factors which restrict tingles. Okay, but what you mainly need to know is that the incision will heal very fast and there will be no scarring. Yes, this procedure is notorious for being the only scar-free procedure. Yes, of course, and do not worry, you will be awake throughout the procedure. However, I will be there with you, okay? And if at any time you feel uncomfortable, we can put you to sleep, okay? Yes. Do you have any questions? No? Well, it is important for us to make a decision and investigate because we have done some scans and MRIs, and I have seen some unusual masses in your tingle center. However, I cannot be sure what they exactly are until I open you up and look a little deeper inside, okay? Okay then, if you are ready, let's wheel you into the operating room and let's get started, okay? Okay. Alright then, let's see what we're dealing with over here. I'm just going to examine the incision. Okay. I see some white granulomas at the bottom over here. These are masses from white blood cells that are acting as tingle blockers, and they're all the way down at the bottom of your spinal nerve, and they are blocking the tingles. And I also see a light collector vein over here. This is the vein that causes you to see those little lights when you're trying to fall asleep when you close your eyes, okay? We're also going to remove that, and you will not have that problem anymore, okay? Also, there seems to be some fibrous tissue that's connecting the white granulomas to your tingle center. We're going to remove it as well. I see some other stuff over here. That also needs to be removed. So we're going to take care of that as well today, okay? Alrighty. Okay. Let me put my gloves on. Nurse, could you please hand me my toolkit? Thank you very much. How are we doing with the blood pressure? Good. Okay, excellent. Patient, are you with us? Yes. How are you feeling so far? Good, okay. Okay, that's great. Okay. First, I will be checking your heartbeat just one more time, okay? Just one more time to make sure that everything is alright. Please take a deep breath in for me. because you're lying on your stomach, I will be checking the side of your lungs just to make sure that your lungs are nice and clear, okay? Deep breath. Yes, okay, good. Deep breath. Okay, good. Okay, good. Okay, good. Everything seems to be absolutely perfect, so we can go ahead and begin with the operation. Okay. Okay, let me just take the safety off. Alright, let me just see in what condition are these little granulomas over here. Okay, they seem to be fairly soft, which is good. It means they haven't been here for a while. They have expanded, from what I can tell. Okay. Now the nerve, I can just see the beginning over here, but it seems to be going all the way up into your brain stem, so it might be kind of a long nerve. Don't worry, we're gonna get it all removed. We're just gonna need to dissect the fibrous tissues that's holding it attached to your body. But don't worry, we're gonna get rid of it. Okay, so first what I'm concerned with is these unfamiliar masses that I'm seeing down here. I actually have no idea what they are. So let's go ahead and nurse, let's send these out to biopsy just in case. Okay, I'm going to go ahead and attempt to get them out. Okay, so just you don't worry at all. Okay, I'm just gonna use my little tweezers over here to just try to get them out of there. Okay. I'm not really sure what I'm dealing with here. Do you hear that? This one's totally calcified. It's rock hard. Okay, let me just. It is quite large and bulbous. I'm not sure if I could pick it up with my tweezers. Okay, let me see now. Let me see now. Look at that. It is transparent in color. It seems to be a tingle tumor that is very rare. It is an extremely rare tingle tumor. Don't worry, it's totally benign. And it was not attached to anything. So it looks to be quite old because it is very, very hard. Okay, let's just put that into the dish over here. Okay, and I seem to be seeing another little mass right there, right there, right there, right there. I'm not very sure what it is. I'm not very sure what it is, but it's quite. It also seems to be very hard. It is quite a strange shape and color. Let me try to. Oh, oopsies. Let me try to tease it out, kind of. Yes. What is that? What do you think that is? It seems to be some kind of a crystallized mass that was blocking one of your tingle nerves. It has taken the shape of the tingle nerve, of the inside of it. Do you see this tubular shape? Yes. Okay. So let's go ahead and put that away. Now, I seem to be seeing some more fibrous tissue over here. It also seems to be quite solid. It has a very linear texture. It has taken the curvature of your spinal column. It's interesting. I haven't seen anything quite like it. Let's put that away. And there's actually another one right there. There is actually another one right there. It is. It's giving me trouble. It's giving me some trouble. Okay, I'm trying to pick it up. This one is even larger in mass and more intense in curvature. It is also quite firm. And as you have noticed, we have no bleeding whatsoever, which is excellent. There is no bleeding. It is quite sturdy, isn't it? Look at that. Oh, it will not get off of my tool here. Okay. Okay. This general area seems to be cleared of masses. So I am just going to take my little surgical brush over here and I'm just going to brush to the reminder of the incision and let's see if we can find any more masses. I'm just going to gently move all the tissue away with the soft bristles. And we're gonna see if there's anything left in there. Let's see over here. I am not seeing anything. Nope, that's it. You're all good. You're all good. I do not see anything. Let me just double check. Let's see over here. That's it. There is no more. There are no more masses. Let's go ahead and get rid of this light nerve over here, shall we? I'm not sure how long it is. I'm not sure how long it is and where it's going. I'm really not sure. We're just gonna try to examine the length over here. Okay. I see it go up over here. Okay. There's a piece of it going over here even. Ooh, it is quite long. It is quite long. It is quite long. I'm going to have to dissect a piece. I'm going to have to dissect a piece. Unfortunately. Okay. Okay, let me just get in with my scissors over here. Okay. It seems to be quite firm. Okay, I got a piece. Look at the residue of it. There is some extensive residue. It is quite soft, the nerve, which means that it is newly developed. It's a newly developed nerve. Okay, I don't think we'll have to dissect anything else. Anything else? I think I can try to extract the rest of it. Do you see it again? Okay, that should all be better once I get this light nerve out. Okay. Oh, that is a big one. Look how long it is. Isn't that crazy? Isn't that crazy, 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 crazy? It is very, very soft. Okay, now let's go on to removing these little white granulomas. Do you see how sticky they are? They are very sticky, 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 sticky. Let's go ahead and get onto the first one. Okay, we got the first one off. Let's go ahead. And remove. Do you see them? Let's remove the second one. No. There you go. There we go. Oh, it's stuck to my forceps. Okay, let me just see. Okay, we got the third one. Okay, we have another one. And there's one more over here. There is one more. There you go. Now we are left with this weird membrane over here. Maybe we could manage just to peel it off. Oh, wouldn't you see that? That's a little hard to peel. Oh, look at that. Oh dear. Oh, look how sticky that membrane is. There's a lot of it in there. Nurse, suction, please. Can you just get all of that membrane of it? Ugh. That is, how am I supposed to discard this? Oh, look at it just. It is quite crispy. It is deforming in my hands. Okay, thank you, nurse. one final examination over here. Just one final examination. I will remove my gloves now. They are quite difficult, aren't they, gloves? Okay. Okay. Okay, let me see what we're dealing with. Okay, what do we have over here? What do we have? That's your bone right there. It seems quite stable. I don't see any cracks or anything like that. It seems very, very durable. Alrighty. Okay. Alright, this area over here. Yes, it's okay. There seems to be no other masses, no other growths, no other tumors. Everything seems to be okay. Okay, and with that final examination, I'm deeming this procedure as success. Nurse, could you please close up in here? Yes, okay then. I will see you in the recovery room in a bit. That was quite a ride, wasn't it? I'm a little sweaty. I'm a little sweaty from all of that, How are you feeling? How are you feeling? Good. You're feeling good. Any pain? No pain at all. That's great. That's great. Okay, the incision looks amazing. Amazing. As expected, there will not be any scarring whatsoever. And the procedure is a total success. Now I'm gonna need to perform a few tests. Just a few test triggers over here. Just a few test triggers over here just to make sure that we got at least some of your tingles back. And don't worry, as the recovery process goes on, the tingles will be more and more intense, okay? Okay. Alright. So first off, I will be performing a visual test, okay? Just a visual test to see if you are getting any tingles. Okay, now I will perform an auditory test, okay? I just want to make sure your hearing is okay. How does that sound in your left ear? Good. How does this sound in your right ear? Good. Alright. That is excellent. Well, you seem to be completely stable, and your signs look very, very good, and your lab results also look absolutely perfect. So yeah, all I advise for you is to have a good night rest, and the incision will be completely healed in a few days, okay? And the stitches are dissolvable, so you do not need to come back unless something is wrong, okay? And also be sure to not take any showers or baths during the next 3 days, okay? And then on the 4th day, make sure to scrub your neck very well to get off the reminder of the dissolvable stitches, okay? And that will be all. Alright, you can take one of my cards over there to have my number just in case something happens, okay? I'm always there for you. I'm always there for you, always there for you. You have been an absolutely wonderful, wonderful, wonderful patient. And hopefully I will not see you here in the hospital, but hopefully I will see you